Well, joining me now via Skype from New Delhi, Washington Post columnist and author Bakhar Dutt. Thank you so much for being with us. Of course, as we've explained, India is reporting its highest rise in cases, and deaths are now putting hospitals on the verge of collapse. And this comes after massive Hindu festivals were held across the country, as well as election rallies. What is the government doing now to try to turn this tragedy around?
Thank you, Rosemary. This is a time of national crisis, a national emergency, and a time of national mourning. The health system has absolutely collapsed, and I use those words with full responsibility. And as a reporter who spent the last fortnight on the ground traveling across India, chronicling ICUs, cremation grounds, graveyards, and funeral sites, I do not believe that even now our political establishment has woken up to the enormity of what we're dealing with, because nothing else would explain the fact that election rallies in one of the eastern states of India are still ongoing, which means mass congregation. This mixed messaging seems absolutely callous, given the fact that I have now met more people than I can count who have been turned away at the doors of hospitals. I have seen them wait at cremation grounds for their chance to even light a funeral pyre. We have seen furnaces that are made from iron corrode and melt and become unoperational because there are at least 100 bodies being brought in on a single day at one single site. We are seeing an underreporting of deaths. There's a huge discrepancy between the official data and the cremations that are actually taking place on the ground, which means the fatalities could be much higher than the world and we as a country are aware of. And finally, amongst the most chilling things I've heard was the doctor who shared with me that because there is no medical oxygen available at almost all hospitals across key cities in India, patients are being made to sign a consent form that effectively says, we are signing a death warrant. If we die because of a lack of oxygen, we will not complain against the hospital. I understand what doctors are going through. They are stretched to the bone. But those are the forms that patients are being made to sign as they're wheeled into hospital with the system literally teetering on the brink. This is breakpoint and worse.
Yeah, it is just a horrifying situation. Of course, at the same time, Prime Minister Modi says that lockdown should only be used as a last resort. But isn't that exactly where the country is right now, with its own healthcare, as you say, buckling under the pressure of too many patients, not enough oxygen or medicine right now? Why doesn't the Prime Minister realise the magnitude of this situation across his country?
I think what happened is that in 2020, a national lockdown was imposed. It was one of the severest lockdowns in the world. Public transport was curtailed, airports were shut, trains were halted, buses weren't plying except at a skeletal service. And what we saw happen at that time was millions of daily wage workers leave the cities and walk to their villages, creating a humanitarian crisis that overshadowed the medical pandemic. The economy was ravaged as well. We're a deeply unequal country, and lockdowns imposed centrally tend to hurt the poor and the marginal disproportionately. But effectively, we are seeing localized lockdowns. It has been left to different states to impose those lockdowns as needed, and many states are now taking that extreme measure of imposing curfews of different kinds. But as we spend time at hospital gates and inside ICUs, another really grim thing that is emerging is that the virus in its second wave is hitting the younger people and even children in a way that it had not in its first wave. We have met 18-day-old babies that are fighting for their lives inside ICUs, at mortuaries. Anecdotally, I can tell you that the kind of fatalities that are coming in are in their mid-30s to their early 40s, defying the assumption that it's the elderly that are necessarily the most vulnerable. And of course, while we're now announcing vaccines for all above 18 from the 1st of May, there is a great deal of anger as to why this vaccine rollout did not happen quicker. There is a sense that we lost a couple of months in approving foreign-made vaccines, that we were very nationalistic about our two domestically manufactured vaccines, and we were basically complacent and triumphalistic about how we dealt with the first wave too early. And now we are literally, we're in the midst of an emergency, and I think even now we have not recognized how bad this is. As I I speak to you, my own father is in the ICU of a hospital battling COVID. This has come home. This is no longer a news story. In every home that I know, there is somebody who is COVID positive.
I am so sorry to hear that you're dealing with that personal situation with your father. It is awful. You mentioned the rollout of vaccinations across the country. They have bumbled along, haven't they? Many countries have, in fact. But India had really moved very quickly in the initial stages, hadn't it? With contracts, with various vaccines. Why did it all go wrong here?
Well, you know, the irony is that we were exporting and gifting vaccines. We were using vaccines as an instrument of soft power. That's how sort of good we thought we were in terms of having dealt with the first bout of the coronavirus pandemic. And now, of course, questions are going to mount as to why those vaccines were gifted away, why they were exported. The history of India tells you that India produces 60%, rather manufactures 60% of the world's vaccines. We've had successful mass immunization programs, but we totally misread. We misread the situation. We did not put oxygen supply in place. We did not roll out the vaccines fast enough. We over-centralized the system. The vaccine regime has now been liberalized. Manufacturers have been allowed to set their own prices. States have been allowed to purchase directly from vaccine manufacturers anywhere in the world. But for the first 2 months, we saw a highly government-controlled, state-controlled regime where Delhi, the capital, was deciding which state would get how many vaccines, which age group would get vaccines. And I can't tell you that I've personally reported vaccine centers that had to close down because there were not enough vaccines. And now, although we're looking at a liberalized regime, the testing is going to be what happens on the 1st of May. It's all very well to say the rules have changed and anyone above 18 can get a jab, but are there going to be enough vaccines, or are we too late even for that? I think these are testing times for this nation.
There most definitely are. And Barkha Dutt, thank you so much for talking with us. We appreciate it.
Thank you. Thank you for having me.